Hello, welcome to my patient Dr. Blessing on health issues. Today, my focus will be on pneumonia disease. Pneumonia disease is very common. Some is fatal and some are mild per se. And we have this particular disease, pneumonia disease, is mostly caused by a bacteria known as Streptococcus pneumoniae. Streptococcus pneumoniae is responsible for some of the pneumonia disease, and this disease exists in two major forms. It can be invasive and non-invasive. Okay, when we talk of invasive, it means that this disease may go a long way to attack major organs in your body. And when we talk of non-invasive, it means that it can be mild and it may not be severe like the invasive form. It can be mild and it can like occurs mostly in my organ or outside of the body. So now, this pneumonia disease causes infections like pneumonia. It causes sinusitis, otitis media. Otitis, that means when your inner ear, there is liquid coming out from your inner ear. So we call that otitis media. So it also goes a long way to even cause osteomyelitis. Now, the invasive form of this infection, that means the invasive form of this disease, that goes a long way to attack major organs of your body. An example of such infection is pneumonia, which is caused by pneumococcus pneumonia, which is caused by streptococcus pneumonia. And those infections that are mild, they are non-invasive. You have the otitis media, you have sinusitis, and you have otitis media sinusitis. Yeah. So now my focus this morning is on pneumococcus pneumonia. Pneumococcus pneumonia is a disease which is life-threatening. It's a disease, a long disease which is life-threatening. It is very fatal. It prolongs hospital stay, and many people are not even aware of pneumococcus pneumonia, which is so deadly. Yeah, it can, as I earlier said, is an invasive form of infection, which goes a long way to destroy your major organs. This pneumococcus pneumonia is caused by a bacteria known as Streptococcus pneumoniae, and this bacteria causes pneumococcus pneumonia. And pneumococcus pneumonia is a lung disease. It's a disease of the lung. It goes and infects the lung. It goes and attacks your lung. And don't forget, the lung is the major organ that we use in breathing. Yeah, the major organ that we use in breathing. So it goes a long way, and now resides at the level of the lungs, makes the lungs to be inflamed and the sacs of the lung to be filled with mucus. And when the lung is inflamed and the sac of the lung is filled with mucus, this makes you very difficult. It makes the individual not to breathe well. You have difficulty in breathing, you have chest pain, you have fever. It's a very, very difficult situation to bear, and this will call for an immediate or an emergency, an immediate intervention by hospital personnel or by the doctor. Now, this bacteria, pneumococcus pneumoniae, or this disease pneumonia, is so deadly. It is not only for a particular age group. It's mostly common with children. Children are very, very vulnerable to pneumonia, and even adults. It doesn't respect age, and it might attack you at any time without giving you any warning. It might attack you at any time without giving you any warning, irrespective of your age. Pneumococcus pneumonia can hit you at any time. So it's something that we should be aware. We should be aware that this disease is very fatal. This disease is common. It is real, and many people are even mistaking it from other sort of infection. There are different types of infection, and then this particular one, the pneumococcus pneumoniae, or the pneumonia disease, which is caused by bacteria, by this bacteria known as Streptococcus pneumoniae, is very, very common. But remember, there are other pneumococcus or pneumonia which is caused by other microorganisms, such as virus, right? You have fungi, you have virus. But the most abundant one, which is very common, which goes a long way to affect your lungs and so on, is the bacteria, on which is caused by Streptococcus pneumoniae. But with children are very, their immune system is weak, and this bacteria also goes a long way to even affect the aging population, especially for those with compromised immunity, especially for those with compromised immune system. People with compromised immune system are people like, for example, such as people who are suffering from HIV/AIDS, diabetes mellitus, that their immune system is really like compromised, is really weakened. So this infection can goes a long way to hit them at any time. So we should be aware that pneumonia is so deadly, and it goes and resides in the lungs. It makes your lungs to be inflamed. You now feel then the sac of your lungs now is being filled with mucus, which makes it which makes the individual to have breathing difficulties, severe chest pain, and you know when you can't breathe well, you know how difficult situation, how the situation can be difficult, and it's so fatal, and it can lead to death. So don't forget that we can easily get pneumonia through what? Through coughing, like when an individual coughs. So that is why it is always good to avoid overcrowding environment, and it is always also very, very good to protect ourselves while we are in the crowd environment, to use our face masks or to keep some space. Yeah, so you can get it through coughing and through droplet. So we should be aware that pneumonia is real, and it does not respect age group, and it is very, very common. Very, very common. Please, 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 for me to continue with this video, please don't forget to follow me on Dr. Blessing on Health Issue, my Facebook page, and to subscribe to my YouTube channel on Dr. Blessing on Health Issue to see the complete video, and to TikTok Dr. Blessing on Health Issue. Thank you.